Hey guys, it's Dr. Nelson. We have questions about how we treat different conditions and how come we're so successful with those. Today we're talking about neck pain. So the main thing I want you to understand is that if the brain is perfectly connected to the body, you'll heal perfectly. Now the brain connects to the body by these things we call nerves. Nerves can get inflamed and then that'll cause problems, okay? Now these nerves are connected to muscles. This is going to become important in a moment. And those muscles connect to joints which house the nerves. You might already be seeing a pattern here that might be a bit of a problem. If those nerves are inflamed, either due to whiplash, chronic tension, sitting at your desk, carrying children, let's be honest, carrying kids is tough on your neck and your shoulders. Emotional issues. A lot of people carry their stress in their shoulders and they're walking around with their shoulders like earmuffs. You don't even need hearing protection. You go to work, your shoulders are up here, or you're answering the phone with your shoulder up here. If you're doing that, first off, please stop, get a headset. Just please, okay. But when those nerves get inflamed, because the joints aren't moving correctly, those nerves then tighten the muscles. Those muscles connect back to the same joints which house the nerves, which runs the muscles, and so this causes a downward spiral. And this means that your brain and your body are playing a game of telephone over here. This is the problem that not just keeps people, because you might have been injured in a car accident, right? Or there might have been a traumatic accident. It's not a lifestyle thing. It could be a lifestyle thing, could be trauma, all right? But why is it staying that way? That's the real problem we have to address. Why is it still staying that way? And so our approach here at Advocate Wellness is to interrupt this downward spiral at every single step. So we make sure that the joints are adjusted so that they're moving properly. Then we make sure we provide red light therapy so that the nerves calm down. And then we provide myofascial therapy, which is like massage, has a lot of similarities to where the joints are able to move more freely. This means that the adjustment is far more comfortable. It lasts a lot longer. The myofascial therapy helps to release trigger points, decrease the tension. We teach you how to do a lot of this at home, a lot of care savings there. And then we're also able to calm the nerves down with red light therapy. All right, and this helps to decrease pain, decrease tension, increase healing by about 2 times. It's a phenomenal therapy. It's also known as cold laser or low-level laser therapy. Very safe, very comfortable. Most people just feel a little bit of warmth, if anything. And in a visit, we're usually able to drop pain by about 3 to 4 points out of 10 on the first visit with people. So I have had amazing teachers and we've been able to develop a phenomenally successful protocol here, and I'm excited to share that with you. If you guys are interested with in coming to see us, we usually have a discounted consult and exam, so just call us to schedule.